thing to remember is that nutrition impacts outcomes. Poor nutrition will delay wound healing, will delay healing from any kind of illness or injury, and it will decrease somebody's functional status as well. So I once had a patient who came into the hospital, her primary issue was chronic migraines. But her migraines were so bad that she had nausea and vomiting to the point where she hadn't eaten or kept any food down for 30 days. And as a result, she had malnutrition, she was refeeding, and she wasn't able to tolerate tube feeds, so we had to put her on TPN. But as soon as we got her on TPN, her hair stopped falling out, the color returned to her face, she was able to get out of bed without being orthostatic, and she was able to go home and live independently.
Communication is key. Working on a team that communicates, the physicians communicate with the nurses, with the NPs, with the dietitians, that's how we best serve our patients. Because we're all the eyes and the ears for the patients, and we're all able to create a full picture of what that patient's life looks like. For example, are the patients taking their medications? The nurse can report back to the doctor about that. Are the patients following the carbohydrate recommendations? The dietitian can report back. So really, that's how we best serve our patients as a team. The place that I work at, we have a wonderful communicative team. Sometimes they'll have me actually go in and they'll go back in and tell the patient what they want to do with medications based on their motivation and my assessment of their nutrition. And that just empowers me to want to be an even more active part of the team. I think that's so important. So we're all here trying to do the best for our patients, and utilizing the dietitian in that journey is definitely key. So communicate with each other.
Understand your limitations as a new physician working with patients. There's a reason why it's an entire team full of people, including physicians, nurses, physical therapists, occupational therapists, dietitians, social workers. When it comes to nutrition, you don't get a lot of hours in med school on nutrition. I, as the dietitian, and my colleagues that's all we learn in school, and that's all we do in our practice. So our nutritional expertise exists in a hospital setting around tube feeding and total parenteral nutrition, around strategies with oral feeding by mouth to help maximize the patient's intake, also around counseling and education, rather than just to tell a patient, you must eat and you need this much, to be able to spend the time with them, break down the reasons behind it, and also figure out motivational strategies to help them meet these goals. Important opportunities for physicians to consult the dietitian include anytime patients come in with unplanned weight loss, reports of eating less than normal, any patients on artificial nutrition support like tube feeding and total parenteral nutrition, and even can be any time a patient may just have questions or concerns or things relating to their diet or their food intake.
Another important thing to remember is to always include nutrition in your plan of care. When you're going over a patient and you're reviewing all of their systems, when you get to the GI system, that should be your trigger to think of, what is this patient's nutrition plan for today? And the dietitians are there as resources for you to help you come up with the best plan of care in regard to a patient's nutrition. The benefit to consulting the dietitian is that we have the expertise, the experience, and the knowledge to come up with the best nutrition plan for your patients. And this is what we get paid for. This is why we're here in the hospital. So use us as a resource.
So when the physician puts in a nutrition consult, we're going to go and actually do a lot of the work. So lifestyle management, exploring patients' motivation, using motivational interviewing, all the tools that we have. And then either the dietitian can follow back, or the physician, if you want to check in with us, we're going to have a wealth of information that we'll be able to share about the environment, the lifestyle that the patient is living in, where they're at with motivational change, if they're motivated to change weight, motivated to change diet and lifestyle, what we're really working on. And we're going to be able to spend a lot of that one-on-one time with your patients. So reaching back out to us, maybe we'll be able to give you a couple of those little pearls of wisdom that we've learned about your specific patient and their lifestyle that will help you better treat them and their medical issues.